Okay, hi everyone again. This is REVOXYLIFE with your host, Dr. Sophia Edwards-Bennett, aka Dr. EB. That's me. Okay. Now, my inaugural episode for my educational videos, I described the radiation therapy process, the delivery. I defined radiation therapy as just high energy X-rays that are used to ablate or kill cancer cells. I also demonstrated the use of the linear accelerator, which is the machine that is used to deliver external beam radiation therapy or high energy X-rays, i.e. photons. I used myself as the demonstration by placing myself on the machine so that you would glean some sense of how the machine delivers the radiation, what the patient experiences on the table, and what the machine looks like in general. Today, I'd like to delve into some of the questions that have been posed and how I approach these questions in my consultation. So I think that the best way to clarify the contents of a consultation with a radiation oncologist is to use a real case, as well as to answer the questions: how, why, when, where, and what. Okay, so when you are referred to a radiation oncologist, you should, of course, confirm that the radiation oncologist is board certified. Now, using the case of breast cancer, I think this is a more relevant and pertinent example. When a female undergoes lumpectomy or breast conservation surgery, that means that the breast was not removed as in a mastectomy, but indeed the tumor was removed and the breast was preserved or conserved. Now, that patient may need to undergo chemotherapy thereafter, and there is a test that is done called the Oncotype DX that determines the indication for chemotherapy after surgery. Now, I am the radiation oncologist, so I won't delve into that any further. Regardless of whether or not the patient requires chemotherapy, they will need radiation therapy after breast conservation surgery. So the patient is referred to me. So the first question is, why? Okay. Patient needs radiation therapy because the studies, most of the studies that have been executed and evaluated and published demonstrate that indeed radiation therapy decreases the risk of the tumor coming back. It decreases the risk of recurrence by up to 70%. And that is a large reduction in recurrence. And so that is the why. That is the answer to the why question. Why do you need to undergo radiation? Now, the next question is, how? How is the actual radiation therapy delivered? Now, in my first educational video, I described the LINAC machine and how it is delivered and the fact that it is delivered using high energy X-rays. And so for external beam radiation therapy delivered to the breast, that is the machine that is going to be used. Now, there are several ways that we can deliver radiation therapy to the breast. Usually, the choices are whole breast or partial breast radiation. Whole breast is treated using what we refer to as 3D conformal radiation therapy or intensity modulated radiation therapy, as in IMRT. Okay, I will go into the details of what that really means in terms of technique as we progress through this educational series. However, simplified radiation therapy is delivered to the whole breast over the course of approximately 5 to 6.5 weeks. There can be a shortened course. It's called the Canadian fractionation. At least that's one example of an abbreviated course. And there are certain factors that we use to determine if a patient is a candidate for a short course of treatment. And that is delivered over the course of 3 to 4 weeks. And most patients prefer that course, of course. But again, there are certain factors that determine if the patient is a candidate. Okay. I mentioned partial breast radiation therapy, and there are also factors to determine if patients are candidates for such. Now, partial breast, as the name suggests, treats the partial breast and not the entire or the whole breast. So it's directed to the lumpectomy cavity, the area where the tumor was, and then removed. So there's a cavity left there. And so the radiation in partial breast technique is delivered to the actual lumpectomy cavity. Now, the techniques that are used to deliver partial breast can be external beam radiation therapy, the same technique we use to deliver whole breast, or it can be what we consider brachytherapy. And that's just inserting an actual device in the breast and leaving that device in the breast to deliver radiation each day, twice daily, for a total of 10 treatments. So it's 5 days. Twice daily, 10 treatments. And that is delivered with high dose radiation therapy. The actual device that is inside the breast is then attached to the high dose radiation machine each time the patient presents for radiation. One of the techniques, and I think I'm probably biased, but the best technique for the delivery of high-dose radiation therapy in the setting of partial breast is actually SAVY, as in S-A-V-Y, and it's quite savvy, I must say. Now, that's the how in a nutshell. So I answered the question of why and how.